Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Every year, millions of people wonder if their thyroid is working right. But before you can know that, you need a test. The problem? Costs are scattered all over the place, processes feel confusing, and you might think you need a doctor's appointment. The good news? That's not true anymore. In this video, we're walking through exactly what thyroid tests cost, how they work, and how to order one online right now without ever leaving your house. Your thyroid is a small butterfly-shaped gland at the base of your neck. According to the NIH, it controls how fast your body uses energy and makes protein. When it's not working right, you might feel tired, gain weight, or feel the opposite, anxious and shaky. That's why thyroid tests are so common. Mayo Clinic notes these tests measure hormones that tell you if your thyroid's doing its job correctly or if something warrants discussion with a healthcare provider. There are actually several different thyroid tests. The most common is TSH, which MedlinePlus explains measures thyroid-stimulating hormone. Then there's free T4, which measures the active thyroid hormone in your blood. Some tests also check for antibodies, which might suggest an autoimmune condition. Most online testing companies start with TSH and free T4, which gives you solid baseline information without ordering 5 different tests. You don't need all of them for initial screening. Here's the number everyone wants. Basic thyroid tests run between $30 and $150 out of pocket. A standalone TSH test at an online lab usually costs $30 to $50. Add free T4 and you're looking at $50 to $80. Full panels with antibody testing can hit $150. Insurance changes everything. Some plans cover the whole thing after a copay, others don't. The real takeaway: know your coverage first, then shop around between companies. Prices vary widely. At-home finger prick kits mail you everything. You collect your sample and send it back. They're convenient and often cheaper up front. But they have real limits. Sample quality depends on you, and results aren't always as precise as blood drawn professionally. Traditional labs are standardized. You go in, they draw blood. Results are more reliable. Cleveland Clinic notes that professional blood draws remain the gold standard for thyroid work because labs can perform more precise follow-up testing if needed. Choose based on what matters to you: convenience or maximum precision. Several companies let you order a thyroid test online without a physician referral. You pick your test, pay, get a kit or an appointment at a lab partner near you, and complete the test. Popular options include Let's Get Checked, Everlywell, and Wellness FX. You order on their site. They ask basic health questions. Then you either do a home test or visit a nearby lab. Results come back in 5 to 10 days, typically. No doctor's referral needed, no insurance claims necessary, though you can submit them if you want. Your results come back with numbers and a reference range. MedlinePlus notes that normal TSH typically falls between 0.4 and 4 millionths per liter, but ranges vary by lab. That's important. 2 different labs might have slightly different normal ranges. High TSH might suggest your thyroid is underactive. Low TSH might suggest the opposite. But interpreting numbers isn't straightforward. Your age, symptoms, and other factors all matter. That's why discussing your results with a healthcare provider is essential. After you get your results, your next move depends on what they show. If results are normal and you feel fine, you might retest in a year or 2. If results are abnormal or you have symptoms, discuss them with a clinician. Results from an online test are just as valid as any doctor-ordered test. They're real data from accredited labs. Many people bring their online results to their regular doctor to discuss options. A healthcare provider can help you understand what the numbers mean for you specifically and whether any follow-up care is needed.